Good morning, everybody. We're gonna start this webinar. My name is Denise Solis. I work for the International Federation of the Red Cross. I'm the Emergency Shelter Senior Officer for the Americas. Welcome to the webinar Management of Collective Centers Facing COVID-19. The purpose of this presentation is to share with you the best practices on how to manage collective centers during COVID-19 operational period and some key considerations for the hurricane season now that the hurricane season just arrived earlier than what we thought. We will have also, I would like to let you all know that as soon as you log in, you will have in your computers a poll, a small survey, just 4 questions. You will have to click either yes or no and send, and it will disappear from your computers. It's just for us to keep on track of who would like to continue receiving information related to shelter, and also to share with you whenever we have webinars or other content related to shelter. Well, thank you for all of you for your time. We're all facing a new reality that we were not ready to have, and our homes have become our main place of security. There are 3 specific population groups that are in high level of vulnerability due to the lack of a home, and that's why we are having this webinar, because some of our national societies are providing assistance in transit centers, collective centers, or similar. That's why we would like to share with you the collaboration that American Red Cross, our American Red Cross colleagues have put together some guidelines of what they have been working before. They have a really good experience working in the management of collective centers. So we're gonna have this. I would like to let you know a couple of information that you must know. If we have Spanish speaking in here, you can click down in the down part of your computer, you will see interpretation. So you can check on that and change it to Spanish. If you need to listen to the presentation in Spanish, we will have simultaneously the translation. The other thing is that I'm gonna take all the questions and we're gonna answer to all of your questions at the end of the presentation. Please write down in the chat box all the questions that you could have related to the presentations, and we're gonna answer to all of your questions at the end. With that said, I would like to introduce to my colleagues from the American Red Cross. Alex Ross is the Senior Associate and Response Strategy, and Anjana Dayal, she's the Director of Community Engagement. So we can start the presentation now. Thank you.
Thank you, Denise. Really happy, both Alex and I are very, very happy to be talking to you all and to share our work today. Really, I'm here to just introduce, to kick off the webinar and really, in the end, talk about other services and partners as part of our shelter programming. But really, Alex is the guru and the brain behind all this work, and his team that's working very, very hard. There are a couple of things that we wanted to say up front that you know, we need to make some adjustments to make sure that, you know, if people are in collective centers, we need to make some very strong, very thoughtful changes in the way we have been doing the collective centers in the United States in the past. And our process really has been to focus on non-congregate shelters or putting people in hotels. That's what we're trying to do in the Americas, in the United States, as much as possible. But we also know with big hurricanes, we are going to be in a place where probably putting people in hotel rooms will not be an option anymore. And that is why for months, Alex and his team, you know, since the last 2 months, they've been working on putting together guidelines around this work, around collective centers. So today's purpose really to share with you that guidance, and also what considerations you may want to consider, to plan as you are planning for your own collective centers in your countries. The other piece that I also want to make sure before I hand it over to Alex is that COVID-19 is a brand new scenario for all of us, right? So it's really important to understand that we are also learning new things about the problem, about the pandemic itself, and also the impact on our sheltering, as we call it, sheltering in the United States, but in the collective center approach. So you will notice that our guidance has been moving forward, or has been changing, or has been modified as we are changing, as we are, learning new issues around the scenario. And so therefore, what we're going to present with you today, it may change in a month because we've learned something new, or in 15 days it may be something different. With that, I will have Alex take the lead from here.
Super.
Alex?
Thank you so much, Anjana. I appreciate it. Okay, so I'm very glad to be here, and I appreciate this opportunity. As Anjana shared, we'll be speaking about the guidance that we've developed within the American Red Cross for our own domestic response for collective centers. I'll just acknowledge that within our own national society and our country, we often refer to these as shelters. So there may be times where you see the term shelter, but specifically that refers to collective centers. I should have control, so if someone is moving the mouse, I'll take it from here. So within the United States, all of the guidance that we're about to speak to is shaped around our fundamental principles, and we all share this: humanity, impartiality, independence, neutrality, voluntary service, unity, and universality. So much of what we do in terms of operating collective centers does not change. And so still within our foundation, our organization is still referring to what we call our standards and procedures. That is our doctrine. Also guiding all of our activities will be alignment with our authorities, whether it's the local government for the emergency management, or the public health authorities. And in the United States, we have those at the local level, at the state level, as well as the federal level. And then in January, we developed a concept of operations around how we respond in the COVID-19 environment. And we've updated that a few times. We actually just came out with our most current version this week. And again, that is a higher level guidance that shapes how we do sheltering. And then specific to collective centers, we've developed some new guidance the top level doctrine is called sheltering in COVID-19 affected areas. And that shapes all the activities we do. So I'm going to advance the slides now. Let's make sure I can do that. There we go. Okay, so what we're looking at here is a diagram. This is a graphical representation of a collective center. What I want to point out is that there's three very specific separate areas. When the public arrives, they come to be screened. And so separate from the dormitory area and separate from what we call the isolation care area, which is where people that have symptoms of COVID-19 or are confirmed to have the virus, people would go there. But before people are directed anywhere, they go to a screening area. And so we have specific guidance of how we operate that, and there's specific questions that we're asking. Ideally, the American Red Cross isn't going to be doing those activities. If our local government and our public health partners are available, we want to partner and they will do those activities. And if someone does identify as having symptoms, whoever just advanced the slide, yeah, if you can just leave it there. I'll let you know when we're ready to move forward. Thank you. If someone does have symptoms, they'll go to the isolation care area, and that's a completely separate area from all other people that don't have symptoms. And one of the things that we've strived to do is we've established this guidance is whenever possible, our collective centers will never have more than 50 people affected by disasters staying there. So that limits the number of people that would be seeking assistance, and that also allows us to have fewer Red Cross workers there to provide that assistance. guidance. Diana, it looks like you're speaking right now. I don't know if you could mute your microphone, but we'd appreciate that. Thank you. And so within the collective center, our standard is 50 disaster affected individuals. We've identified that every person should have 110 square feet of space, and in meters, that's 33.5 square meters per individual. That allows us to have a cot for each person and 6 feet of distance on both sides on all four sides of where they would be sleeping. That also allows additional space for other services within that dormitory. We're going to go through a few more details about what is going on inside that collective center, but I also want to note, you see in the top right corner, there's a pets section, and that's a completely separate building. It's totally separate, and we do not want to allow pets inside, though service animals would always be welcome. We can go to the next slide. And so what we see here, what I want to really be emphasizing is what's different. Because when we speak to the American Red Cross workforce, we really stress that our mission has not changed, but how we deliver our mission is what needs to change. So we're adjusting our operations to minimize the spread of COVID-19. We will accomplish this through screening and access control in our shelters, increased sanitation activities, ensuring social distancing, expecting that everyone will stay 6 feet apart unless they're a family unit, caring for those with symptoms in a separate isolation area, intentionally operating. I'm sorry, whoever advanced the slide, if you could go back. I'm not controlling the slide. If someone could go back, I would appreciate that. Thank you. Operating with a smaller workforce, and then having the maximum capacity, 50 or fewer clients. I think all of us are wondering, well, what happens when there's a much larger disaster? If possible, we want to have multiple collective centers, each of them operating with 50 or fewer clients. And when I say the word client, that's a common terminology in the United States for those that we're serving, but I mean those that have been affected by the disaster who are seeking our assistance. I also want to acknowledge that operating collective centers is not our preferred method. When resources are available, we do want to use non-congregate options. That might be a university dormitory, so everyone has separate living spaces. It might be using hotels. And again, the American Red Cross is going to work with our local governments and the other agencies to determine the best options. So on this next slide, we see that to ensure the safety of both our workforce and our clients, we expect everybody to be wearing a mask, and then also to maintain distancing of 2 meters for everybody. And we've developed certain job tools that we use to go over with our workforce, as well as the people that we're serving. There will be a screening area. I apologize for people, and I don't know who's advancing the slides. If you want to do that, you can do it when I ask. Otherwise, I think it may just be easier for me to do it myself at the right time. Thank you. So the screening area is located separate, as I said, from the dormitory. And we actually want to have physical barriers. Those could be cones, that could be caution tape, but something so that people know that they should not go into the area for the dormitory or the feeding area or the isolation until they've gone through the screening. When someone goes to the screening, we're taking their temperatures and we're asking them some questions, to identify if they have any symptoms. That screening area ideally will just be set up outside. You could see it's a tent, maybe there's a few tables, and that allows us to really make sure that it's kept separate from where everyone will be staying. Here what we see is that there's a real physical barrier that separates people. So even if the screening has to be inside, it will be separate from the collective center. You can go to the next slide. What we see is as people pass through the screening area, clients will then be directed either to the isolation care area or the dormitory based on their screening results. And that's where we go through the normal collective center process that we've always done in the American Red Cross. We register our clients, we provide them with information welcoming them, making sure that they understand the services that we provide and how we're going to be able to help them. And we assign them to a cot inside their housing area. The registration process is also going to include reviewing all of the applicable shelter rules with our clients, including those directly pertaining to COVID activities, such as increased sanitation procedures and social distancing. We're going to be practicing and maintaining good health actions, such as washing hands, wearing a face mask, cleaning and disinfecting surfaces, and that's critical to the health and safety of everyone in the shelter. Again, I apologize that I keep interrupting this presentation to ask. The person who's advancing the slides, are you doing it because I should go faster? I can speed this up if that's what you want me to do. Otherwise, I would prefer if, I'm just going to pause for a second for someone to let me know if I should go faster.
Hey, Alex, no, I don't know what's going on. And Jenna, she's helping us moving the slides. So, and Jenna,
No,
can you?
I'm not moving either. I don't know what's going on.
Okay, so I know I can control it if other people don't do it. So I'm going to start controlling it from now on. And I'll just do my best to keep up. And I apologize for everyone for this disruption.
And Alex, just so that you know, you're on the right pace. You don't need to speed it up. You're
okay.
Fine.
I appreciate that. Thank you.
Yes.
So as we acknowledged, our collective center operations are guided by certain principles and existing standards. And the SPHERE standards, public environmental health standards, those must all be continually promoted and pursued. And it's important that we do that so that our partners that we're always working with understand. And so as we meet with them in advance of responding to emergencies and disasters, we're making sure that they understand why we're taking certain actions that we are, why we plan to clean surfaces as frequently as we do, and recognizing that the American Red Cross and none of our national societies can do what we do without strong partnerships, helping them understand that there's certain things that we won't be able to do, and perhaps you can do those with us. So in this diagram, we can see how a setup of a collective center will be different. As I said, the measurements that we use in the United States is 110 square feet per client, which is 33.5 meters. Traditionally, what we plan for is 12 square meters for every single client in the dormitory area. So that requires a much larger space. And then we're also making sure that the people are sleeping what we say head to toe, which just adds a little bit more separation between people. I'm gonna go back, and I apologize that this keeps advancing. When there's more space available, we of course want to increase it beyond the 2 meters between each of the cots. And then we also acknowledge that families are going to want to stay together, and that's okay, but we can't block the aisles or the lanes. And we're not going to fill in additional people when families decide to move their cots closer. We're maintaining social distancing and food safety when we're doing the feeding. So what you see right here is people are lined up waiting to get food, and everyone is 2 meters apart or 6 feet. When someone approaches the table to pick up their food, it's already been put there by a food service worker, and they've put it down and then they step back. And so now they're 2 meters behind the table, and then someone walks up to get it. And before we put more food out there, we're gonna do additional sanitation on that table to clean off the surface. That's the safest way that we know to provide meals. As you can see, each meal is individually packaged. Quite often in a pre-COVID environment, there's a lot of ways that there may be increased transmission of viruses and diseases, and that's something that we can't do when we're operating collective centers in this time frame. each Red Cross Collective Center will have an isolation care area where individuals will be housed. And that's only for people that are identified with COVID symptoms or that do not pass the screening questions, but don't need hospitalization. If someone is very ill, we're going to work with our public health system to identify if there's a better option or location for those people to stay. I apologize. The slides are moving around and I'm doing my best to back them up when I can. The isolation care area is an authorized access only area. It's not a place where people can just walk in and out. We need to make sure that those who are there are either have symptoms or are confirmed to be ill, or are trained health professionals and have appropriate protective equipment, which includes a face shield, a mask, goggles, gloves, and a gown. And all workers assigned to that isolation care area must be wearing that. So when we set up the isolation care area, the entrance is where the personal protective equipment is put on and off. And again, we're going to want at least 110 square feet per individual, but we also will take more space if we can. And so here we see that there's only 10 cots with 10 disaster-affected individuals, and we put some dividers between them. And that might be plastic sheeting, it might be a blanket if that's all we have, but as much separation as we can, we're going to establish that there. The people that work in this area, again, are all going to be wearing personal protective equipment. So in this next slide, I want to talk about when we do establish a collective center for 50 disaster affected individuals or less, what is the standard staffing that we would do? All of these people are going to be working very closely together. We see that there's 6 different positions in that dormitory area. And then if the American Red Cross is supporting the screening area, which I spoke about earlier, or if we are operating the isolation care area, then we're going to add additional people with that particular training to support that. But if the only services that the American Red Cross is doing at a particular collective center is going to be the operation of the dormitory, we'll have a shelter manager, someone focused on the safety of the site, someone focused on the logistics, which will include the human resources and all the stuff and the things that we need, a generalist, someone focused on the health services, and then one other person focused on the specific individuals who have been affected. And our preference is someone that has a disaster mental health or disaster spiritual care training background. So this is 6 people. And we look to them to engage those people that have been affected by the disaster to be helpers. Many people may have backgrounds that are appropriate to supporting the operations in that collective center. Of course, when there's additional challenges that arise in a particular collective center and there's additional human resources available, we'll figure out the right solution. But we're being very intentional to try to limit the number of people that are together so that ultimately we continue to flatten the curve and not increase the potential transmission. That workforce, those six Red Cross workers for the dormitory, they cover both the day and the night shifts, which means we need to make sure that they're taking care of themselves, that nobody is working more than 12 hours per day. And quite often, as I acknowledge, when there's a smaller number of people that are affected, it's easier for us to engage those disaster-affected individuals to support. And again, as I acknowledge, there will be additional staffing for disaster health services. And the Red Cross looks to our public health partners with the government and other agencies to support that staffing when it's available. Anjana, is this where I'm passing it to you?
Yes, sir.
Okay, and I'll pass the screen control back to you, but certainly seems like other people have the control too.
No, it seems, so we figured out, Denise and I were actually doing the side WhatsApp conversation. It seems the slides have timer on. And I don't want to take the
Understood.
timer off right now in
Okay.
front of
Good.
all of these,
Okay.
about 50
Figured
people.
it out.
So we'll just keep clicking it backwards when we need to. And I'm really sorry for all those watching the slide deck, how the slides are moving. So sincere apologies for that. I hope nobody's having a, what's the word in English? You're not getting help me somebody. Your head's not starting to turn around. Apologies. All right. So just wanted to build on what Alex, and thank you so much, Alex, for the great presentation. I think some really good, clear guidelines are there, and we want to acknowledge, both Alex and I want to acknowledge that, this is what American Red Cross is doing. This is what our context allows us to do. This is what, we have figured out with our stakeholders, our government, based on our government guidelines, based on the partners that we have. You all represent different countries, different national societies or federation. So all of this obviously is, up for contextualization and adaptation according to your own context. So that's something super important for us all to remember. So building on that point, when we talked about our integrated teams and we have very specific personnel that we want to be there for that shelter in this environment, for you all, if you have a CEA program and you want to have a CEA personnel expert in there, just so that somebody is really engaging with the communities on a regular basis, make sure you have somebody there, PGI or gender specialist, if you have somebody there who can actually look at gender and diversity and some specific issues around the at-risk vulnerable populations, make sure you have someone there constantly, or at least visit a week your collective centers to also focus on those issues. And that's what we're going to now talk about. For example, a wash person, a feeding person. So for wash considerations, some things that we have considered here is to make sure that there is access to safe water for drinking and hand washing. We know that hand washing is extremely in this COVID-19 environment. Separate bathrooms for men and women, make sure there's sufficient lighting in the area. And then there is rigorous sanitation for all the common areas. That's, I think, extremely, extremely important, because, no matter how much you wear your gloves and other things, this looks like this pandemic really moves very, very fast. So as much sanitization that can go in, that's good, right? And then promotion of hygiene as part of COVID-19 safety messaging. You can do that as part of your morning, evening meetings. If you are having those, you can have brochures, you can have, papers around the different walls in your shelter or outside, and even also in your isolation areas and things like that. And then separate bathrooms, just want to emphasize that there are separate bathrooms for men and women, but also within that scenario, if you have isolation areas, very separate bathrooms just for that, and if you can also separate those isolation bathrooms between men and women just for safety and dignity purposes. In terms of PGI considerations, I just want to talk about very, very high level. I don't want to go into details, but just to give you some ideas, we have a person on that solely focuses on disability integration, and not only she has a whole cadre internally of the Red Cross personnel, volunteers that are out there in the field. We also have partnerships with others. So a lot of the PGI considerations are also taken care of through our partners. So for example, for children, we have Save the Children in the United States. We have Children Disaster Services, and Children Disaster Services has given us a really good children's kit. Because as you can understand, we can't really have child-friendly spaces. We don't want different children to come together, because you never know which child is carrying the infection. So what we're suggesting is that as much as possible, children are with their family, with their caregivers, and then there are a list of activities that CDC has shared with us for children to be able to do right there where they are, in the little room or in little area that they are with their parents. So there's some fun things that children can do, which also include help them to, it's kind of like also from psychosocial support perspective, it's good for them, but also facilitate some learning for them. So from education perspective as well, it's good, right? And for women and other vulnerable groups, that's why I said, if possible, have your PGI experts, if they're not available for every day for all the collective centers, make sure they're visiting every other day, your CE people, and also if your mental health folks, your psychosocial support people who can provide psychological first aid, who can provide a safe space when needed to have a conversation, probably through phone, right? This person can share that, I need to talk, and maybe it's better that they speak on the phone if possible. And if it's absolutely important or needed that this person meets with this person one-on-one, then make sure that they're wearing their personal protective equipment and following all the guidelines that they need to. And so that was the PGI consideration. And for coordination mechanisms, there's a lot of different platforms. For us here, there's a FEMA call, which is a Federal Emergency Management Agency, that has a national level call that they do, and we have our government operations people that will participate. Sometimes our leadership will participate in those calls. But also there are national level feeding calls. For example, today our feeding expert is having I think they've already had their national feeding call with different partners, and and with CDC, actually, CDC, our Centers for Disease Control, is participating in that call, and they're going to give new guidelines. Like I said earlier also, and you all probably are also experiencing, the understanding and knowledge about this pandemic is changing every day. So we have to continuously improve, modify our guidelines according to the new knowledge we're getting. So those are some national level coordination calls, but there are also VOAD, something called Voluntary Agencies Active in Disasters. And so there's a national call there also where, my team participates on that every bi-weekly. There are spiritual calls, mental health calls that are happening at the national level. But at the same time, you also have state level coordination calls. So if there is a hurricane or if there's a storm in one geographical area, usually that state, that county or district or that city will have their own, that level of coordination mechanisms that will also happen, and Red Cross will participate in those calls. There are also state emergency operations centers where we send our team members to staff that all day, their people every day at the national level, at the state level as well. And then we also have a beautiful map, a GIS map, where we call it the partner brief. It really comes from a project that we had for Partners Hub, where we have all the partners that are active, feeding banks or food banks, or other different groceries that are open, supermarkets that are open. So that on the map you can see the geographical area, and then you have little icons where it'll tell you what different partners are active, what different groceries, pharmacies, various different pieces of information right there. And we share that also with our partners as well. So it's not just for us to use, but once it gets started to update, we start sharing it also with our partners. And then we also send like a communique. My team usually sends that out for all the partners as to where the Red Cross is, what we're doing, that kind of thing. And then also, like I said, for PGI and other things, we have organizations that are focusing on children. There's free legal aid. Recently, as you all know, there has been an increase in domestic violence around the world as a result of all the stress during this pandemic. So we've also, especially for our minority populations here in America, we've also started to partner with some organizations, some resources that actually focus on the SGBV issues and abuse against children and those kinds of things. So I think that is it. And then, okay, no, we have some more to go. So what are our guiding principles? First and biggest thing is we upfront said that the Red Cross is not an expert on a pandemic, not the American Red Cross in America. And we have CDC. So right from the beginning, we have been following the CDC guidance. And as it evolves, we evolve our programs, and we continue to sort of update our guidance. A lot of work has gone in there. And like Alex said up front, it's the 7 fundamental principles, right? We want to make sure that everybody is taken care of based on our fundamental principles. We are being inclusive in a meaningful way, and we are providing support to anybody and everybody, whether it's no matter, whether it's a race issue or if they're sick or anything like that. And then the other piece, we want to do hoteling or, non-congregate or non-collective centers until we can, unless that's the only option left, which, Alex and I were talking yesterday. When there's a huge hurricane, there is no way, that we can still put people in hotels, and we will have to be ready. And that is why all this guidance in place, right? So that those are some. I don't want to read everything in here. You have all of this, and then workforce safety is the paramount. Whatever we do, we want to make sure that our staff and volunteers are safe. And there are times when we have, tried to restrict our activities just so that we make sure that our staff is not put at risk. So that's another huge thing.
And when Meals on Wheels come on back in, you're going to look up in Ms. Place in Ms. already.
Ma'am, please, if your line is not mute and you're not speaking, please mute your line. That'll be really helpful. Thank you so much. Okay, and then, using technology, phones, FaceTime, online stuff that can be done. For example, one of the things, even though it's not directly related to shelters, we just have released our virtual family assistance center as part of our condolence care support. So we have a website where people can go and they can actually look at what resources, what their needs are. They can talk to us from that website. I need spiritual care, I need support with the burial of my dear one, or anything. So those are some. The technology-based intervention is also, it's a driver for us and in this environment. So is probably for you all, right? So looking at those things is what the guiding principle is. I just want to say that because I'm not going to read all of this right now, and because of the timing issue as well, I just want to say that we have a video that Denise will be sharing with you, which is about these slides even more in details. With Alex has, he's taped his voice with it. So it's a really good YouTube video that you will get. So anything, if you think you're missing on this or you've not been able to read this slide deck, you will get that video and you'll be able to get all the information, and you can see it in your own time and repeat it as much as you want if you need. So here are the final thoughts. Our mission and our fundamental principles have not changed, thankfully. So that's good. Thank you, Corona. At least COVID-19 has not impacted that part. Our mission's just done in a different way, but the mission remains very, very the same. I've already said collective centers are not the preferred approach. We will only do it when we need to do it. And in terms of what are some things that we want to do and change in the collective centers scenario, is the screening and isolation areas are required for all of those collective centers. Making sure that our cots and everything are aligned in a way to make sure that there is enough social distancing, and the feeding the way we feed is changed, and then the staffing composition, it's more making sure that as much virtual services are used, that's what we prefer, and also the integrated staff approach. And then this is really Red Cross is the beacon of hope, right? We are the ones that bring hope in our communities. And how do we do that in our collective centers? How do we make sure that every client, every person, every survivor that comes to our collective center, how are we dealing with them with dignity? How are we making sure that we're paying attention to their specific needs and their strengths, right? Not only seeing them as passive victim, but really seeing them as active survivor. How are we making sure that they're connected to somebody that's looking at their maybe disability, or maybe their issue related to their gender, related to what their status, another status is. So all of those different things have to be taken care of. So really an integrated approach in your shelter and your collective center is what we need to really think of. And I know you all are already thinking of. So this was what we are doing in the United States. Any questions for us?
Yes, and Jenna, we have several questions. So I'm going to start to read all the questions, recommendations, and congratulations from the colleagues that have been writing down. So the first one, it comes from Mr. Rinaldi Forbes. He's the chairman of the Grand Bahama branch. He has two questions. One, the first one is, when using shelter, especially those which are building which do not have a utility, is there any consideration to ventilation? Any enclosed area in which the air is not properly ventilated only increase spreading the COVID or the virus that it might have? That's the first one.
Yeah, that's an excellent question, and as the way he phrased the question acknowledges, and I'm not a public health expert, so I'm only going to repeat what I know. The more airflow and exchange that exists, the better it is to dissipate the potential droplets and the transmission of the virus from one person to another. And so the ideal solution, there would not be a collective center at all. People and families would be able to be in separate spaces. Our guidance at this moment from the American Red Cross does not specifically state what airflow should occur. It does not specifically state that people should go in that one door and everyone should travel and go out another direction. It doesn't specifically state what the air conditioning handling system should be. That said, this is such an important point, and it's an area that I think we can continue to strengthen the guidance within the American Red Cross. And currently we're looking to our other partners in terms of what their recommendations are. Ultimately, though, that our challenge will always be, if a hurricane is approaching, it's safer to get out of the storm surge and into a building that's far away from the low-lying area where the flooding or the winds may harm people. And so that's the balance that we'll always need to acknowledge. But as the question said, we don't specify what that should be, and that's an important point that I hope that we can acknowledge in our own guidance.
Okay. The second question is, with the staffing of persons in shelter, I saw a tent for animals. Is the staffing listed also staffing the animal tents, or is there any additional?
Wonderful question. The American Red Cross focuses on helping families that have been affected by emergencies and disasters at the collective centers. But our primary focus is the individuals and the humans, and we look to our partners to provide that service. So we are not the experts when it comes to sheltering animals, but we do know that it is not safe for the animals to be co-located and to potentially be increasing the surface areas that could transmit the virus inside the collective center. So in terms of what the staffing model should be, we have different partners across the country and in all the different communities, and ultimately they're going to decide what the right numbers should be and how much space there should be, say, between the cages or where the animals are housed. But we, in that diagram, mostly what we're trying to focus on is that will not be inside the dormitory.
Okay. The next question, it comes from one of our shelter colleagues for the IFRC. Deepti wants to know, I am also curious if you can expand on where the 110 square foot came from. Is this also adopted globally as per recommendations set by the World Health Organization or the shelter CCCM cluster for standard spacing for collective centers to mitigate the COVID-19? Thanks.
That's a fantastic question, Dipti, and it's I mean, a sincere pleasure and opportunity for the American Red Cross to join all of our colleagues from the other national societies and from the Federation. This is a number that 110 square feet per person in the collective center is a number that we did not determine with the WHO or with the CCM cluster. We welcome collaborating with others. That's a number that we set, I think, in the end of February. We knew that the American government was recommending 6 feet of distance per individual. And so essentially we did math. We said if there's 6 feet between each cot in all 4 directions, that is how we got to 110 square feet per person. I do not know if there is a planning recommendation that other agencies, whether within national societies or international humanitarian agencies, have established. So that's a number that we have right now. But we also acknowledge that there is not always that much space. And so again, everything we talked about is more focused on a post-impact event where there's a smaller number of people that are affected. If there's a mass evacuation of people and 1,000 of them need to all take shelter in a single collective center, quite likely there might not be 110 square feet available. And so in that instance, the American Red Cross will not put cots for every single person. And then we can have fewer square feet, perhaps 60 square feet per person, but still be able to establish that 6 feet of distance per individual and per family member.
Okay, the next question, well, more than question, is a recommendation from Daniel Arango. He's one of the disaster managers for the Federation. The recommendation is, if the screening is done outdoors, plan for rain and people trying to take a shelter.
Absolutely.
Then Hamid Mumtaz, he's one of the shelter colleagues working in the Bahamas. He is telling us great initiatives, precautions to use of toilet and washrooms or some other guidelines will be very helpful. So it's for us to share more information related, like guidelines related to wash.
Mm-hmm.
Tulio Mateo, he is a shelter advisor for Catholic Relief Services. He wants to know, what are the recommendations for children's socials and playgrounds?
Yeah, I'll take that. So first of all, we really want to say that children, as much as possible, should remain with their caregivers. And then the caregivers should be empowered with, activities and tools and kits to be able to play with the children. And also, if you can also at the right time, at the time, real time, if you can provide some training to them about children's emotions and how stress impacts children and those kinds of things, just so that caregivers are actually skilled and ready to deal with kids, because we're really seeing in the United States a lot that now that children are with parents 24/7, which is not usually the case, right? They go to the school and everything else. Parents are facing a lot of stress, and we want to make sure that their stress is transferred to the kids as well. So if possible, make sure that the caregivers are empowered to take care of their children in a meaningful way, in an appropriate fashion in this very stressful environment. If you think you have a huge space where you think you can bring children, and again, have a conversation, consult with your medical guidelines, your government's guidelines, your medical staff on the ground. So don't say, Anjana said this on webinar, so we can do it. No, please consult your local guidelines and things like that. And if you have a huge playground, maybe children can wear a PPE, all their masks and everything, and maybe they can sit in the ground 6 feet apart from each other, and they can sing songs and they can talk or ask questions. So you will have to be really creative, but in consultation with your stakeholders and within the parameters of the medical guidelines that you have on the ground, depending on how big the spread is in your region. I hope that answers the question.
Okay, let's move to the next question. It's from Stefan Kishore. Good afternoon. Can you advise on technical background on how the 110 square foot was derived?
So I think I already answered that, which was essentially the distance from each cot would be 6 feet in all 4 directions. And then that creates the amount of square feet that we need in the dormitory. The one thing I want to stress is other square footage or square meters will be needed because all we're talking about is the dormitory area where people are sleeping. And so needing additional space for feeding, for the health services, for the isolation care, for the screening, that's even more space that we will need at the site level.
Then the second question from Stefan Kishore is, will staff at the shelter stay in 24/7 during the operation of the shelter, or will the shift system remain? My concern is that staff who leave may take the virus out of the shelter.
That's very true. That's such an important point. And I think we can also acknowledge that the disaster-affected individuals staying at the shelter or the collective center, perhaps they're going to go to work and then they're going to come back, or they're going to go visit family members and make sure that they're safe before they come back to the collective center to stay. So I think before I answer the question, we need to acknowledge that there are many people in our communities right now who may be affected by the virus but are asymptomatic, and we don't know. We also want to acknowledge that as a national society and a federation, we need to do our best to not increase transmission. So it's a very important balance. What we're striving to do by screening everybody as they come in is having an area where only those who have symptoms will be in the isolation care area under the care of the health services, and everyone else will be separated. That said, we're all still wearing our face masks inside, and we're all maintaining 6-foot distance. And so the short answer to your question is, we do not expect our workforce to stay at the dormitory, and that may be unrealistic expectation for us to deliver our services, because they ultimately would not get the break and the self-care that they would need. But again, this is a balance, and the American Red Cross is not going to make that decision individually in every single operation. Our local health authorities may ultimately decide that we need to change our protocols. And so while it's not our plan, that may ultimately occur in certain instances.
Well, I think that I can help in this one, also taking into consideration the experiences that we are having in the Americas, in Bolivia, what they are doing. The staff that is supporting, let's say, the transit center in the border with Chile, what they are doing is that the staff stays over there because this is a transit center that was set up for families that are returning from Chile to Bolivia. So what the government did is they set up this transit center as a quarantine. So the staff is the staff that is receiving the families, they stay in that area during the quarantine period, and then they change. Then they do rotations with other staff, and the ones that go out, they stay in quarantine in order to, if there's any cases that are going on in the shelter, in the transit center, they stay. Whenever they get out of the transit center, they go to a quarantine period to try to avoid spreading the virus, because that's what we are having in here. Moving to the next question. Robert Davis is asking us, is the presentation available on the internet? Well, I think that Anjana just mentioned before, we're recording this presentation, so we're gonna share the recording, and other than that, American Red Cross has an available link of YouTube that you're gonna be able just to check the presentation that they did. Then we have Tammy Mitchell. She works for the government of the Bahamas. She's also requesting, can this presentation be emailed? It can be helpful for us. We have a hurricane, like a storm in our heads right now, so it's gonna be really helpful. Then we have another one from Josette Edward. Josette is the program officer of the Environmental Sustainability Cluster here in the Caribbean. She is saying, I suppose that persons coming in will have their temperatures taken.
Great question. So let me take a minute and I'll describe the procedures when we do the health screening. And again, this happens before people go either to the isolation care area or to the dormitory. The first thing that our screening team is going to do is assess the clients or the disaster affected individuals to see if they're coughing or if we can see any specific symptoms. Whether or not they are, we want to make sure that everyone has a mask and everyone is staying 6 feet apart. Then we're going to ask 3 questions. Do you or anyone in your household currently have a cough, fever, or any respiratory illness? The next question we ask is, have you or anyone in your household been in close contact with anyone who's been confirmed as having COVID-19? And then the third question is, are you or anyone in your household a healthcare worker caring for a confirmed COVID-19 patient? If they answer yes to any of those questions, we're going to direct them to the isolation care area. And if they say no to all 3 of those questions, then we're going to take their temperature. And if their temperature, I'm sorry, I don't know this in Celsius. If their temperature is 99.5 degrees Fahrenheit or higher, then we're going to direct them to the isolation care area. So that's the process. And then once they come, if they do not have a temperature that exceeds the threshold and they go to the general dormitory, we're going to be taking everyone's health status every single day. And that's part of our expectation and our rules of the Red Cross Collective Center is that they follow our rules. And one of them is that they participate in the wellness check every single day.
Okay, so we have one last question. It comes from Cristina Pareja. She wants to know, will vulnerable populations be separated from general population?
That's another good question. All of these are wonderful questions. Right now, our aim, when we can confine the number of people to 50 or fewer clients or people affected by disaster, while we acknowledge that certain people may have a higher risk or level of concern of the impact of having the virus compared to someone who may be younger or doesn't have comorbidity, we do not have certain thresholds that are already described. We work with our local public health officials to determine if someone should be separated. But I think what we know about the virus is changing so much. I mean, just from like 2 weeks ago to now, there's more concern about things just besides the respiratory system or for younger people. So we do not have that described in the American Red Cross guidance in terms of who would be separated, but we do acknowledge that people with higher risk would be the first who would ultimately receive a non-congregate sheltering option, which would likely be a hotel or perhaps staying in a college dormitory.
So that was the last question. Thank you so much, Alex and Jenna, for the presentation. It was really good. And I think that we touched all the questions and answers in appropriate time. I'm gonna move on to the part of key messages for hurricane season during coronavirus outbreak. I'm gonna apologize in advance because somehow the slides are moving without us moving them. So our apologies for that. Well, we wanted to do these highlights and provide these key messages since the hurricane season is coming, but more than that, here we are already, it came earlier than what we thought. So let me just try to go to the back. So we have 3 main things that we have to do before a hurricane. The first one is be alert. The same way that Alex and Jana, they were mentioning, we are all in different contexts, and according to the context, we have different restrictions and state restrictions. Somehow we don't, in many countries, we don't even are allowed to go out of our homes in some, so plan in advance, be alert to what the government is providing you, make a plan. All of these things need to take consideration the COVID situation. We are usually in the Caribbean, families, they do make a plan, they build a kit and they are alert. But now that we have this COVID situation, we need to take that into consideration and see how the local authorities are going to work. With making a plan, our suggestion will be to try to avoid the congregate shelters that they are going to be open whenever a hurricane comes. it's if you have a relative or a family or someone that you know that lives in a safer place, try to go to that area so that you will be safer in a friend's place than in a collective center. Then for building a kit, American Red Cross, they are also making 3 recommendations. The first one is a stay-at-home kit. So prepare yourselves for at least 2 weeks of emergency supplies, taking into consideration what we are having with COVID, like all the extra, maybe alcohol, all the extra masks that we should have at home. An evacuation kit, it's a go bag. It's let's say 3 things that you can put in a small bag that you can move with that bag whenever there's the need. Like if a hurricane strikes, you can go out of your home with this small bag that it's easier to carry. And the last point is 1 month of supply of prescription medication. If you currently have any type of illness, try to get medication for yourself or for your family. The challenges if a major hurricane strikes with coronavirus outbreak. Well, there are many challenges that we are gonna face, but things that we need to consider is that maintaining the principles of social distancing and quarantine after a hurricane, that's gonna be one of the biggest ones. Local markets have limited capacity to provide the basic needs for the population, so that's why you need to plan in advance and get ready. And the last one is housing accommodation capacity may be limited. So try to recognize the safer areas for you and your family. And if you know that you're in a low area here in the Caribbean, try to identify with time where you're gonna be able to move. In addition to this is more for our national societies, for them to start sharing the information that they have related to shelter and preparedness considerations. There are 3 topics that I wanna touch. The first one is going to be strengthening their homes. The second one is what other plans they should take into consideration for the contingency plans and around collective centers. So strengthening homes. In order to prevent that hurricane damage completely or destroyed our home, we need to reinforce and take a look at how it's our structure of our home. Is it working or not? We need to check our roof and put some hurricane straps if needed. Check the structural, seal properly our doors and windows. Secure the outside of the house to prevent flooding if we are in low areas. Then moving to the contingency plans that we would like the National Society to take into consideration. Of course, we know that they are going to distribute key messages. Make sure that you have adequate household items to cover basic needs in stock according to your context. For example, here in the Bahamas that we just had a hurricane the last season, we are doing some repairs. So it might be appropriate to see if we have in stock some tarpaulins to support those families that we're currently doing some repairs so that they're gonna be able to at least cover the roofs if there is still any holes on it. And the last one is think about what type of immediate assistance you could provide with financial assistance program. And related to shelter, now that we're talking and having some discussions about families that are moving from one place to the other, the immigrant population, and well, a way that we can assist these families is maybe with rental assistance, vouchers for hotels, and any other the multi-purpose assistance that some national societies are already applying. But maybe if we are already having this type of assistance, we can think if there's the need to extend this assistance and see how we're going to link this assistance related to the COVID plans that we are having on each national society. And the last, collective centers, as our colleagues just mentioned, try to find a shelter with another family or friend, because going to a collective center should be our last resource. No family, no person is going to be feeling safe in a shelter or in a collective center. So that's why we need to plan in advance. But in the cases that where we are already working in collective centers, like in cases of Central America and South America and here in the Caribbean, if we might be having still some collective centers open. So we need to check if there's the need to improve those collective centers or shelters. Here in the Caribbean, they use the word shelter for collective centers, so that's why I'm talking about them both. But over all the presentation, we use the word collective centers because that's the way that we know it globally. The importance and the maintenance to do repairs and careful modification if needed. We need to, if you are having these collective centers open, try to make a re-evaluation of the capacity of the existing collecting centers, because if you are already over the capacity, if there's a major hurricane, maybe we need to check if there's another collective centers that we need to open. So, because we're having COVID-19 and we need to take extra measures and extra space between people, we might end up needing to have extra spaces to receive families. And last but not least, which is really important, to training our staff and so that they can be ready to assist our local authorities, because as the Red Cross, we are an auxiliary in an auxiliary position to the governments. So the best thing that we can do is train our staff so that they can be ready to respond to the emergency. That's it from our part. Thank you so much, guys, for you to join us today. We are going to save all these questions and answers plus the presentation, and we're gonna put them all available into a link that I will send you to your, since you all signed into a registration, I have all of your emails. So I'm gonna be able to send you back the presentation with the questions and answers. And if there were some extra questions that were coming through meanwhile we were discussing, I'm gonna answer to your questions in the document that I'm going to submit. That's it from us. Thank you, Anjana. Thank you, Alex, for the opportunity for sharing the information that you guys have been developing. And as they mentioned before, this is a situation that it's gonna be evolving and we need to adapt ourselves and our response.
Thank you for the opportunity for us to come and share. All the very best to everybody. Bye.
Bye.